In this video, we'll be taking a look at some of the factors that influence how we go about selecting an antimicrobial procedure. At the end of the day, there's no perfect antimicrobial procedure. Whether you need to achieve sterilization, disinfection, sanitization, whatever it may be, every procedure usually has some benefits and also some drawbacks. What really is going to play a significant role is considering several key factors that will ultimately help you determine what direction you should go in. These factors include things like the type and the number of microbes, the environmental conditions, the risk of infection, along with the composition of each item to be treated. So we'll take a look at each one of these factors individually and expand a little bit upon how they are going to influence our choice of antimicrobial procedure. First, the type of microbes. While many microbes can be controlled via normal procedures, you do have to take into account that some microbes are highly resistant. These highly resistant microbes, if you're going to account for those in your antimicrobial procedure, may require you to do a little bit more. For instance, bacterial endospores. Bacterial endospores are formed under harsh conditions, extreme temperatures, introduction of toxins, lack of nutrients, things like this. Well, because of the harsh conditions that lead to their formation, the endospores are highly resistant to outside influences. So you have to use a particular type of heat to try and control the growth of those endospores. And certain chemicals would also be needed that would go above and beyond those that we see typically in order to try and control the growth of bacterial endospores. Protozoan cyst and oocysts. The protozoan cyst and oocysts are kind of like the eukaryotic equivalent of endospores. The cysts and oocysts are going to be highly resistant to outside influences. So we have to go to a little bit further of an extreme, so to speak, in order to try and deal with them. You can see that they require boiling. Now, in most cases, if you had simply hot water, that would be very effective at achieving antimicrobial control. But hot water isn't enough, for instance, to deal with protozoan cysts and oocysts. It has to be boiling water, which is significantly hotter. Mycobacterium species contain mycolic acids in their cell walls. That mycolic acid being present ultimately causes those cell walls to be more waxy in consistency. And this creates a problem from an antimicrobial standpoint because it imparts resistance, the waxy nature of their cell wall, to multiple antimicrobial substances. So once again, Mycobacterium species would be a little bit more difficult to achieve control of. Pseudomonas species, they are more problematic in an inpatient setting. They're a common culprit in some nosocomial or hospital-acquired infections. The Pseudomonas species, once again, would be highly resistant. They usually are found in watery environments, moist environments, and it's not uncommon to see some of those situations play out within the hospital. Finally, we have non-enveloped viruses. An envelope is essentially a biological membrane that surrounds some viruses. It's composed basically like a phospholipid bilayer. Well, essentially, the enveloped viruses, those that actually have an envelope, are more easily destroyed because, well, the envelope behaves similar to a biological membrane. It makes the virus susceptible to heat and various other antimicrobial substances. At the end of the day, though, the non-enveloped viruses are more problematic. Since they lack that envelope, like I said, it's equivalent to essentially a biological membrane. Since these non-enveloped viruses don't have that, it can create a problem because they have other protective mechanisms that will ultimately cause them to be more resistant. So you've got several types of microbes that are highly resistant, and when choosing the proper antimicrobial procedure, depending upon whether you need sanitization, disinfection, or so forth and so on, you would have to account for these organisms or microbes accordingly. Next up, the number of microorganisms. There's a very simple relationship here. The greater the number of organisms at the start, the longer it will take for you to achieve any sort of control, whether that's sanitization, disinfection, or whatever the case may be. If you have a lower number of organisms to start, it will take you less time to achieve control. Once again, whatever that method of control may be, it will just always take less time. There is a way to try and reduce the number of organisms. You could always wash the material if possible. Washing usually removes a significant number of organisms, and that would once again reduce the amount of time that it takes in order to eliminate those organisms and achieve control. In order to try and assess the effectiveness or how effective an antimicrobial chemical may be, a lot of times we look at the decimal reduction time, or the d-value. It's the amount of time required to kill 90% of the organisms present under specific conditions. It could be a specific heat or temperature. It could be a specific amount of pressure, specific number of organisms. All of those factors are regulated so that you can compare these different antimicrobial substances across the board without having to worry about one being more effective just because you started with fewer organisms, for instance. So the d-value is more of a standardized measurement of the effectiveness of a given antimicrobial chemical. We do also consider the environmental conditions. If you look at potential contaminants from the environment, things like dirt, grease, bodily fluids, all of those may interfere with the ability of your antimicrobial procedure to attack or get to the microbe. So that could influence, your choice of antimicrobial procedure. If organisms are arranged or organized into a biofilm, we've talked about those in a previous lecture. Biofilms become resistant because the organisms help one another to prevent possible damage due to the antimicrobial procedure. That could also be a problem. Finally, we have temperature and pH. Both are influential over an antimicrobial procedure because essentially at higher temperatures or lower pHs, biological membranes become leakier. The leakier the membrane, the easier it is to try and affect that particular cell. So overall, if you warm up whatever you're trying to achieve control over, if it's some sort of, for instance, a scalpel, just kind of hypothesizing here, or if you place it in a solution that has a lower pH, whatever you're doing will be more effective at attaining control because the membrane of that prokaryotic cell becomes leakier and it's easier for the microbe to be influenced by that antimicrobial procedure. Next up, we do have to consider the risk of infection. Most medical instruments fall into one of three categories: critical items, semi-critical items, and non-critical instruments or non-critical items. Critical items have to be sterile. That means they must be void of any vegetative organisms, viruses, and also endospores. This is because they're going to come in contact with human tissue. And you don't want to introduce an organism that could be vegetative into a human tissue, or even an endospore, a dormant form of an organism into human tissue where it could become vegetative again. Semi-critical instruments only contact mucous membranes, but they're not going to enter body tissues. So there's a little bit less strenuous of a requirement when it comes to these semi-critical instruments because they're not coming in contact with body tissues. They do have to be free of viruses and any living bacteria or vegetative bacteria. They should also be free of endospores as well. Although many of those endospores can be blocked by the mucous membranes, we don't want to run the risk of spores possibly germinating and then becoming active infections. These would be instruments such as endoscopes and endotracheal tubes. These would go into your throat. They don't directly contact your tissues, but they do come in contact with the mucous membranes. Lastly, here we have the non-critical instruments and surfaces. These contact unbroken skin only, so there's a very low risk of infection. Things like countertops, stethoscopes, and blood pressure cuffs. So there's no need for sterilization here because, well, the organisms would be typically naturally encountered in your everyday environment, so to speak. Lastly, here we have to consider the composition of the item. Metals and plastics don't behave the same. So if I could heat a metal in order to achieve sterilization, odds are I can't do that with a plastic because it would melt. So we have to consider the composition of the item as we select our antimicrobial procedure. You can use heat, as I said, to try and sterilize metals, but definitely not for plastics and certain soft materials. Irradiation is a great alternative to heat, but in some cases it can damage plastics. Moist heat, which is essentially autoclaving and liquid disinfectants, can't be used to treat moisture sensitive materials. This is because ultimately the moisture sensitivity would allow those liquids, in the case of liquid chemical disinfectants, and the steam, the water vapor from the moist heat, to damage that particular material. So in considering what it is, or rather in considering the antimicrobial procedure, you definitely need to take into account these factors: type and number of microbes, environmental conditions, the risk of infection, along with the composition of the item that is being treated.